called as a pernicious anemia. Actually, pernicious anemia is a macroplastic anemia, is right? And it is a vitamin B12 deficiency where the intrinsic factors is affected. That is there is a poor absorption of vitamin B12, and it is an autoimmune destruction of parietal cells. So here,
patient identification. This is a case of 52-year-old female patient who was admitted to the medical ward of our hospital. Chief complaints: the patient presented with the complaints of progressive, weakly, easy legibility and shortness of breath on extension for the past 4 months, along with tingling sensation in both hands and feet.
So his history of present illnesses, the patient was apparently normal for about 4 months ago. After she developed gradual onset of weakness, the symptoms progressively worsened and were associated with loss of appetite and weight loss. She also complained of difficulty in walking and numbness, suggesting neurological involvement. There was no history of bleeding, fever or chronic illness. So his past medical history is there is no history of diabetes mellitus, hypertension and tuberculosis or previous blood transfusion. The patient has no history of gastric surgery.
Dietary history. The patient is a strict vegetarian for the past several years, which may have contributed to vitamin B12 deficiency. Family history. There is no significant family history of anemia or hereditary disorders. However, a history of autoimmune disease in family members was
the patient has normal bowel and bladder habits. Sleep is disturbed due to fatigue. No history of smoking or alcohol consumption. General examination. On examination, the patient was conscious and oriented. Pallor was present. Mild icterus was noted. No lymphadenopathy or edema was observed.
By seeing the patient vital signs, the temperature is normal and pulse 90 beats by minute, blood pressure 110 by 70 mmHg, respiratory rate 20 cycles by minutes. Systemic examination, cardiovascular system, soft systolic murmur present, respiratory system normal. The patient vital signs, the temperature is normal, pulse rate is 96 beats by minute, blood pressure 110 by 70 mmHg, respiratory rate 20 cycles by minutes. Now we can see the systemic examination. The cardiovascular system has soft systolic murmur present, and then there is a respiratory system and it has a normal vesicular breath sound, and next is abdominal examination and it has a no organomegaly. Then the last is neurological examination and it has a decreased vibration sense and impaired proprioception in lower limbs.
Investigation, laboratory investigation revealed low hemoglobin level, rise to MCV and macrocyte anemia. Peripheral nurse showed macroolivatory with hypersegmented neutrophils. Serum vitamin B12 levels were markedly better. Antibodies were positive. Coming to the diagnosis, based on a clinical factors, laboratory finding and antibodies testing, the patient was diagnosed as pernicious anemia.
The patient was treated with intramuscular vitamin B12 injection, starting with loading doses followed by monthly maintenance therapy. For supportive care and neurological monitoring we are provided. Outcome and following up. The patient should significant outcome and following up. The patient should significant improvement in hemoglobin level and reduction and neurological symptoms after treatment. She was advised lifelong vitamin B12 therapy and regular following up.
in of this case presentation, this case highlights the importance of early diagnosis of pernicious anemia to prevent irreversible neurological complications. So lifelong vitamin B12 replacement remains the cornerstone of management. So thank you guys for preparing this presentations. I hope you all should understand. So thank you.